Hi everyone, the question for today is a 4-year-old boy was brought to pediatric OPD with history of fever for the past 5 days and rashes all over the body. On examination, bilateral conjunctivitis was present, tongue appeared bright red, morbilliform rash was present on the trunk with desquamation and there was swelling of hands and feet. Which of the following disease is a possibility? So, giant cell arthritis, granulomatosis with polyangiitis, Kawasaki's disease, and chickenpox. This is the appearance of tongue, and this is the rash over the back with desquamation. So, each and every point here is very, very important. So, it's basically a 4-year-old child with fever, conjunctivitis, bright red tongue, rash, and swelling of the hands and feet. So, this is a typical history of a particular disease. But if you don't know what's the disease, you can answer this question by excluding the other option. So age is a very important clue over here. So this is out of question because it affects old age predominantly. So giant cell arthritis is a vasculitis which affects old age people and especially it affects the temporal artery, right? Next is chickenpox, which is out of question. This rash doesn't look like chickenpox and the given history doesn't fit into chickenpox. So you have option B and C. So granulomatosis with polyangiitis, this was previously called Viginous granulomatosis. I hope most of you know that Viginous granulomatosis will have renal and pulmonary manifestations, which is not in the history. So a diagnosis here is clearly a Kawasaki's disease. Okay. So what is Kawasaki's disease? So remember, Kawasaki's disease is a vasculitis which predominantly affects children. So it's a vasculitis which affects children. So the age is a very, very important clue over here. So when you classify vasculitis, you classify based on the type of the blood vessel involved and the type of antibodies you have, the serology. So some vasculitis can involve the large blood vessels, some can involve medium-sized blood vessel, and some can involve the small-sized blood vessel. So remember, Kawasaki's disease predominantly involves your medium-sized blood vessel. So that's very, very important. So Kawasaki's disease involves your medium-sized blood vessel, but you can have involvement of other blood vessels as well. So medium-sized blood vessel meaning you can have involvement of your coronaries. So this can lead to formation of aneurysm which can either rupture or thrombose and it can lead to formation of myocardial infarction in children. So any childhood vasculitis which can present with myocardial infarction is Kawasaki's disease which affects your medium-sized blood vessels. So this is point number 1. So it affects children, medium-sized blood vessel. Point number 2 is what is the type of antibodies you have? You have anti-endothelial cell antibodies. So this again is very important. So you have anti-endothelial cell antibodies. Now, what's the diagnostic criteria? So if it is take the diagnostic criteria, you must have fever plus any 4 of these features, cream. So conjunctivitis, which is a non-purulent and a non-exudative conjunctivitis. You can have rash, edema of the hands and feet, lymphadenopathy, especially of cervical lymphadenopathy, and mucosal involvement like involvement of your tongue which leads to a strawberry tongue. So to summarize, what you should remember in Kawasaki's disease is it affects medium-sized blood vessel, it can affect your coronaries leading to myocardial infarction, it affects children, and this is the diagnostic criteria, fever with any 4 of these. So because of these features, it's also called mucocutaneous lymph node syndrome. It's also called mucocutaneous lymph node syndrome, right? So remember it affects medium-sized blood vessels and children. So having discussed about strawberry tongue, which is seen in Kawasaki's, so remember there is something called strawberry gums, which you see in Viginous granulomatosis, which is now called granulomatosis with polyangiitis. So strawberry tongue is seen in Kawasaki's, strawberry gums is seen in granulomatosis with polyangiitis. Thank you.